on the day of International Day of Ending Violence Against Women, with all the work you have done for gender equality, what are your findings and what are the main causes of violence, which is similar around the world?
Thank you, Zheela, for having me to discuss this very important issue. You know, I'd say at the highest level, when we look globally, no country has achieved gender equality. And the continuation of violence against women and girls is a manifestation of the fact that many cultures and contexts around the world continue to value women and their safety, their security, their agency, and their autonomy less than they do for men and boys. I think in the COVID context, we're seeing this even more magnified because we see that economic strains can lead families to suffer increased stress and tension in their households. That can increase violence. The inability to have separation, right, under lockdowns and quarantine measures, that can increase violence just by sheer quantity of time that survivors of violence spend with perpetrators, not to mention their inability to leave those contexts. So there is, of course, a pre-COVID gender inequality problem that leads to the toxic masculinity that justifies violence, and there is this magnification now in the pandemic.
You work on different countries. What are the similarities of narratives when it comes to violence against women? And of course, COVID contributed to the increasing violence against women as well.
It's a really good question. I think what is most notable about this particular human rights and development issue is that we don't see it in contexts only, right? I mean, when we think about other development outcomes or other forms of gender inequality, whether it's a lack of equal access to quality education for girls, or a lack of access to contraception and family planning services, a lot of those things correlate with the income level of a particular country, right? That we see those outcomes improve the wealthier a country context becomes. Violence is not that way, right? We see 1 in 3 women globally experience some form of violence over the course of their lifetime. That applies to the United States as much as it would apply to Afghanistan or India or Kenya or what have you. And I think that's where we need to look to gender norms that play out in different ways in different contexts, but again, fundamentally come back to that devaluation of women, that justification of violence. We often draw upon data from the World Values Survey that asks questions both to men and to women about whether rape in marriage or wife beating, if a woman does something wrong, is justified. And sadly, in a lot of places around the world, even women themselves are still at a place where they think a woman doesn't have a right to refuse sex within her own marriage, or a man is justified in beating his wife if she burns dinner or doesn't keep a clean house. So it's really going to have to be an interrogation and a reform of those norms that will fix this issue.
You mentioned Afghan women, for example. A lot of Afghan women achieved a lot and they are in leadership positions, but still the violence against women didn't reduce. Are you suggesting that like leaders, primary leaders of the country should contribute more in ending violence against women?
Absolutely. So right now, myself, Amber Peterman, another CGD researcher, and co-authors have been looking at the extent to which violence is increasing in the COVID context. We have also been looking to interrogate the extent to which donor institutions and in-country policymakers and political leaders are understanding that dynamic and responding accordingly. And unfortunately, even pre-COVID, the financing in this space paled in comparison to the need. I mean, a shockingly small amount of donor financing and government support is directed towards shelters or women's rights organizations that provide legal services or psychosocial services. And that financing is going to need to increase. It's going to need to follow a political will, a political prioritization of recognizing that this issue is as important as all of us in the gender space think it is.
A lot of women during COVID lost jobs, and they're pushed away from their jobs due to childcare, or they could not manage, or because women, they lose their jobs. And there's still a pay gap, like gender-based pay gap among women. What has to be done to narrow down this gender pay gap for women?
A number of things. So a lot of the gender pay gap is stemming not from bias between men and women in the same sector, right? So if I am a nurse and a man is a nurse and he is getting paid more than me, some of it stems from that. But the vast majority is actually stemming from occupational sex segregation. So the fact that more often than not, the woman is the nurse and the man is the doctor, or the woman is the early childhood or preschool teacher and the man is the professor. And we're seeing these gaps slowly but surely close over time, but it's going to take a crossover of women into male-dominated professions and in reverse, men into female-dominated professions in order for that gap to close. The second thing I'd say that's really notable is what we call the motherhood penalty. So oftentimes as an early career professional, a woman and a man entering the workforce aren't as likely to see a significant gap in their wages or compensation. It's when a woman has children and bears the disproportionate unpaid care burden that's associated with child rearing that she takes time out of the workforce. She may have difficulty resuming her hours, advancing as quickly, that we start to see that pay gap widen.
Yeah. So last question, how COVID increased the economic hardship of women? Like some experts I spoke to, they call it not recession, it's a she-cession.
So we've touched briefly on gender-based violence, and the impact that that can have on women's productivity is notable. Touched very briefly on the care economy and the fact that as schools close, as childcare centers close, it is women leaving their jobs or being less productive in the workforce in order to care for children and make up that gap. The third and thing we haven't touched on so far is related to what I was saying about occupational sex segregation, and that as within this crisis and global recession, women-dominated sectors have been disproportionately impacted. So women are more likely to be those in the service sector who are at the grocery store, for example, who are working as childcare providers. These are not only essential workers, right, that we have come to recognize and at least rhetorically to value, but they're also the ones who are most vulnerable to maybe getting sick, to maybe losing their jobs, and as a result, this rhetoric around a she-cession has become quite popular in the media. Yeah.